Hi, hope you're well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And this Sunday morning, a little different to the usual time myself and Sunny do lives, but this morning we're speaking to another one of our guests on our journey in the use of ultrasound in our aesthetics work. Today, Sonny unfortunately is tied up with some work. He's been doing some work last night and he's having some trouble getting back and he's a little bit tired, so I'll be on my own today. But hi to Lisa Hackett, who'll be joining me, and she's a sonographer from Sydney in Australia. So I will just invite, there we go. Just trying to invite you, Lisa. If you're able to, oh, not yet. If you're able to request to join me, Lisa, there's a little button right at the bottom of your screen, and it should let you invite yourself to join me. So I'll just wait for Lisa. I'll try and send her an invite. Let me just see if I can send you an invite. Won't be a second. Right. There we go. So you should receive an invite, and if you just accept it, you should be able to join me any second now, hopefully. Here we go.
I got to do it on my phone.
Hi, Lisa. How are you doing?
I'm so good. How are you? I told you I
Fine.
was tech savvy. Can you hear me?
Oh, you've managed to do this without any problems, so well done.
But I'm on my phone. I'm not on my laptop. But anyway,
Don't
it's all
don't
good.
worry.
How
Is
are
this
you?
okay? Is this okay for you on your phone?
Absolutely. What about you?
Yes, yeah, I can hear and see you fine, and that's it's good to be able to talk. I actually heard about you through Stuart at Vinyl a
Yeah.
few months back when myself and Sunny were doing a live with him. And more recently, because of Mobin Master, who put us together on social media. And it was really nice to be able to speak to you over the last few weeks about doing a live with you. Um, I was just mentioning, Sunny unfortunately can't join us today because he was doing some work last night, having trouble getting back home through the snow, and he's probably going to be a little bit tired as well, unfortunately. So we'll be back next Thursday to do a live about ultrasound. But hopefully you'll be happy just talking to me about your work, Lisa.
Yes, absolutely. I mean, God, that's my dream to get over and have a white Christmas. So maybe we should swap positions. So next year, because it's
Yeah,
so hot here, it's really hot
yeah.
here today. So
What
you can come over
temperature is
here
it
and
there?
today it was 30.
30 degrees, right? We're
Yeah, it
talking
was dead hot.
0 degrees here.
We're talking Celsius. Oh, you're
Yeah,
zero there. You're zero
yeah,
there.
0.
Oh.
Yeah. But
Oh, well, see,
anyway,
look, I've got my Christmas tree. See, can you see?
oh, very nice. Yes,
Yeah,
fantastic.
my Christmas tree. So we'll have to
Nice.
meet in person. But can I
Yeah,
say, I'm actually very honoured and chuffed that you actually asked to speak to me today. I've been so nervous and excited
oh, don't worry.
to
It's
talk to
we've been
you.
doing myself and Sonny. We've been doing lives for around about the last 6, 7 months now.
Yeah,
Talking about ultrasound and its
yeah,
use in our aesthetics work. So we've spoken to lots of different specialists, educators, trainers from around the world,
mm,
and it was really nice to be able to speak to you today. So I've got to thank you
yeah.
for joining me. What
No, of
I'll
course.
do Yeah, what I'll do, Lisa, I'll talk a little bit about your background. You can talk about the how you've got into the whole area of sonography, the
Yeah.
study of using ultrasound in different areas of medicine. So, how did you become a sonographer? And tell us a little bit about the different types of work that you did when you first started working, Lisa.
Okay, well, I'm a radiographer first, and so I just fell into ultrasound actually because I've been doing this for a long time. And back in the day, if you took a special interest in something, you sort of gravitated your way in. So that's what I did. And I was working in private practice, and I didn't really like radiography anymore. And I just liked the fact that in ultrasound, you could see inside the body. And it was amazing to see a pancreas and to see a liver and to watch how people breathe. And so that was my, you know, first attraction to seeing these little pixels that become pictures, you know. And so from there, yeah, it just grew. So I got into muscular ultrasound in 1993 in Australia because we didn't have MRI. And I just took over the job from someone who was leaving. She said, do you want to take the job? I said, sure. So, and this is in the very beginning when there was no courses and I knew what things looked like on ultrasound, and the doctor at the time was the doctor. So we started working together, and I worked for the first 10 years of my career with hand surgeons in Sydney. So we did all the work for all the Sydney hand surgeons. So I knew all about, you know, tendons and moving and gliding and how nerves glide, and you know, because the surgeons were very, very generous with their knowledge, and they were very interested, like all of you guys, in ultrasound and what it could do. And it's cost effective, you know, you get patients involved so they feel like they're actually involved in their treatment rather than being told what they can and can't do, which is, I think, extremely empowering. So then from there, I got into sports, sort of sports medicine. So I knew some sports guys and girls, and once again, I knew ultrasound. And I remember one of the doctors, Justin Paoloni, his name was. He was a sports doctor for the Australian cricket side and one of the footy sides here in Australia in rugby league. And he said to me one day, oh, you know, this guy's knee and his patella. I said, I can see that with the ultrasound. He goes, no, you can't. I went, come this way. So showed him what the patella looked like, and he had patella tendonitis and he had a bit of mucoid degeneration. So I said, I can guide you in there if you want to try this autologous blood. And he's like, you think? And I said, let's try. And that's how it started. So I started working with him because he was impressed and I was stoked. And then that went on to other sports doctors, Dr. Jenny Saunders, who's a specialist in pelvic instability. So we developed ultrasound guided SI joint injections with PRP as opposed to glucose. So that prolotherapy, and we published papers on that. So that was really interesting. Then I also worked with another really good sports physician, and his name's Dr. John Orchard. He's very, very involved also in sports. So I met these guys just through the common love. Well, I love ultrasound and what it can actually do for someone, and they appreciate it just like you guys. So then and that makes me more passionate and wanting to learn more and seeing what you can and more importantly, what you can't see. It doesn't take anything away from your clinical expertise. It actually acts as a really nice adjunct if it's done correctly. That's where hopefully I step in. And then for the last 15 years, I've worked with a shoulder surgeon. So So, you know, taught him ultrasound and what you can see and how you can see tendons, and then, you know, went into theatre. So I knew what I was looking at. So then I could appreciate the size of the tendon and the actual shoulder joint. And then we just killed it, you know, doing all this research with tendon repairs and assessing them post-operatively. And that's my PhD work. So doing all sort of stuff using ultrasound once again, you know, applying.
You've done so much. You've done so much over the years.
Yeah, but it's interesting, you know, Viv, and this is why I was really excited. And I'll probably rumble on, so you've got to say stop. But it's just, I get excited when I'm able to work with professionals and learn and grow together and collaborate together. And, you know, like the good thing is I can make pictures out of black, whites and greys, right? So I can say to you, oh, this is a muscle, and you're going to go, why? And I go, because this is what it looks like, and you've got a white fascial band around it, and the little white lines in it are fibers, and if you activate it, you know, it falls up and all those sorts of things. So with this nice sort of like wave, I suppose you like, and everybody it's phenomenal the way in which everybody is embracing ultrasound, and that really lightens my heart, and it really gives me a lot of encouragement and just fuels more of my passion. because
It's
I think there's
amazing.
a lot of work that can be done. Yeah, it's
And
fantastic. And the face is unique.
yes, yeah, that's what I was going to
Mm,
ask you about. You've done a
mm,
lot of work with MSK, sports medicine
mm.
in particular. How did you get into the whole area of facial ultrasound and its application in aesthetics in particular?
Okay, well, I'm very safety conscious, and I always think that if you because I do a lot of guidance, I've always done natal guidance, and I've assisted and blah 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 blah. So I just sort of, and this was, I wanted to get into this actually before COVID. So I spoke to a very good friend of mine about going to Cosmeticon, and she extended an invitation to go for me to go. So I did, and I looked around, and I thought, there's a place actually for ultrasound. I feel this is way before I knew anybody was doing it. I didn't, and this is in Sydney, and I'm like, and I thought, I think it could actually really help because you've all got amazing skill, and this just, I feel, and I still do, I felt that it could give you something. So then COVID hit, so couldn't do it. And then Stuart and I hooked up again, and I said, what about the aesthetics? He goes, oh my gosh, like, I'm thinking of doing it, so let's do it. Let's just have a crack. And
Yeah.
that's what's happened. So, it's really good. It's that's just the way it happens, right?
It's amazing because myself and Sunny, we've spoken to a few different practitioners and trainers from Australia.
Right.
Jake Sloan, we spoke to Jake a few months back. We spoke to Martina Lavery, I think,
Yeah.
who you know in Sydney.
Yes, yes, she's fabulous.
Also, yeah, and Stuart, we spoke to Stuart a few months
Yes.
back, and Mobin Master a couple of
Yes,
weeks back. We spoke
yeah.
to him as well,
Yeah.
and
I went to
it's
that as well,
amazing
yeah.
how much knowledge and skill you all have and how much you're willing to share everything you know about your
Mm.
area of expertise. In terms of the education and training that you provide, Lisa, who do you train and how can they access what you provide to them?
Okay, I've been doing some education with Stuart, so he supplies the systems, and because he's a physio by background, so it's just sort of worked really well that way. So what we like to do is provide the service of showing you how to use an ultrasound machine, number one, because you need to understand how that works. Number two, I show my part of understanding or identifying structures, and then together we live scan, and we've had guests with us as well. So we've had Dr. Chris Rogan, who's an interventional radiologist. We've had we had Dr. Ryan the other day who came. He's a cosmetic doctor, ED doctor. Herbert Huey's done a little bit with us. So we're very, very lucky that we have people that want to partake and just grow. So the people that we are teaching are people that want to learn. So which I must say, the response has been phenomenal. It's very uplifting, and it gives me a lot of encouragement and makes me want to do better and learn better. But we like to run a course where it's limited numbers. So really, you don't want to have too many because it's really a hand-on skill. And if you're not used to that, looking at the anatomy in that cross section, it gets a little bit daunting. And also the size of the muscles are so small. Like, I thought the supraspinatus was small, right? It's 2 centimeters. These muscles are smaller than, and the depth is only 2 centimeters really. So and also the function of the face is completely different to the rest of the musculoskeletal system because it doesn't insert into bone. It inserts into fascia, or it inserts into skin, which is unique in itself. So ultrasound in that way is an emerging field, in my opinion, and that's who we teach. So our education is very, very interactive as well. So we like to break it up, or you know what we do? We run our courses for the delegates. So what they want to learn, we will gravitate towards that. But we always have, the good old chicken with the needle guidance, so you get the feel and stuff, because that helps you sort of get your eyes set in the direction, particularly angulation, because these tissues that you're guiding are very superficial. So there's added little things you can do, like bending the needle, looking at the cannula. Cannula is really hard, right? So You know, they're difficult in themselves, particularly if you want to dissolve, you know, filler. But there's a whole world out there. So that's what we're doing. So our courses are constantly evolving. They're constantly changing, because in the space of the aesthetics that I've been looking at already, the changes already have been phenomenal. And that's very, very exciting, you know. But ultrasound is something that is adaptive as well.
Yeah, it's amazing to be able to hear from somebody like you about the whole world of training practitioners. What do they think of the work that you do? From any feedback that you've received over the training you've provided to aesthetic practitioners, what has their view been of your training, Lisa?
Their views have been very kind and very encouraging. When people want to come and learn something, they're happy to do it. That's half the battle. They're already keen. They want to learn. So everything that we give them, it's just, they're like sponges. Like, so am I. So our response has been wonderful. You know, we've got really good positive feedback. We actually have feedback as we're going through anyway. Like, I'll go around and I'll say, so what do you think? What do you want to do? We tend to send out or I'll send out messages, and Stuart will, you know, is there anything particularly that you'd like to learn? That's what I normally do with any of my MSK training. What would you like? I want to focus then on what that person or that group actually require.
Yeah.
So that's the way that we're going.
Yeah, it's really nice to be able to speak to somebody like you. I think you know Candice Deary in the States as well. Both two of you are both sonographers, and she does training as well. And she was mentioning that you're her soul sister. I think that's what she said to me.
Yeah, soul sisters, because we're sonographers and we're on the same page. So we're looking at doing you know, something together as well. Like, you know, I mean, look, I just think like I keep referring back to, this field is wonderful. It's very, very unique, and everyone I've come in contact with, and this includes Candice and the doctors and Stella and Leonie and you know, people and yourselves wanting to learn, wanting to connect with you. That is fantastic, you know. So yes, Candice and I, we are soul sisters because we are sonographers. We have a different approach. So the other thing is too, we wanted to touch base with each other to make sure that we are actually on the same page as well. So when it comes to education, you don't have conflicting ideas, because that then causes a bit of a problem. So if everybody's sort of like on the same page with what things look like under ultrasound, you sort of can't go wrong. That foundation, once that foundation is there and it's reproducible, the world's your oyster. You know, the practitioner, the clinician, the surgeon, whoever uses this type of imaging application can then tailor it to the cohort of patients that they see. You know, so for example, I'm doing some work with Herbert Huey now, and he teaches how to do threading. So I approached Herbert and I said, I'm sure that you could see the depth of the skin with ultrasound. Therefore, you could guide the people that you're teaching in properly, so they don't go too deep or too superficial as we do with threads. And that has actually been a very, very nice addition, I would like to say, to his education. So I go and I'll do the guidance, and then we will talk through together. And it's quite remarkable when we have the doctors there or the nurses that are wanting to do threads, and their face is just priceless, because it's like, oh my gosh, I didn't realize it was so like superficial, or oh my goodness, like the photographs like there, or I was like, oh, you know. So it's actually, and then that visual sort of like recognition automatically connects to your hands, right? So you have memory, and then that will teach you to share. You know, that's what it's all about. I mean, look, it's wonderful. You and Sunny, you know, you're stoked in this sort of thing. You want to learn, you know, you've developed a podcast on ultrasound and aesthetics. I mean, who would have thought? It's 2022, 2023. So it's
it all started off with myself and Sunny, because of beginning our journey in the use of ultrasound ourselves earlier this year, and we thought, you know what, we'll tell our story, and then if other people, we can involve them in that. It'd be great if we can share, and others can learn from all of us about what can be achieved using this technology. There'll be practitioners watching, Lisa, who may be thinking, you know, I'm curious about ultrasound and maybe whether it can help me or not, but I need maybe a little more information or advice. There's lots of different scanners around. Like, how would you advise maybe a practitioner in terms of the equipment and maybe the training? What would you say, where should a practitioner begin in terms of looking at how they can utilize the technology in their own work? Where would they begin? What advice would you give them?
Well, what I would do and what I do, I will, or I'm asked, and I'll ask them, okay, number one, what do they want to do? Do they want to do complications, or would they like to invest in a system and implement into their practice, their everyday scanning? So it's very much an individual thing, number one. So you have to work out what you want to do. Yeah, that's number one. Number two is the cost. Yeah. So you have to, you know, you've got to look at the systems that are out there. There's all different types of systems that are available, you know, these days as well. So you want to be able to be informed across the board, so you've got options. So number one, like I said, I would ask them what cohort they have and what sort of work do they do. From that, I would be able to sort of have an understanding of what sort of equipment they would require, if any, because they may not need to have one. They could have a call-out person, or they could, you know, have someone that could assist them in complications, et cetera, until they decided if they really felt that they needed to outlay for the system. So for me, you know, the two systems that are out there right now are handheld or portables. Now, so to be honest, let's be real here. I in MSK, I work with very high-end systems, so they're 160 grand at least, yeah? Completely different sort of need for this type of work. However, in saying that, the face, and I have to keep saying this, the face is the most intricate part of the body that I've ever scanned. And it's exciting because there's so many things to see, but it's scary because there's so many things that get me overcalled. So the system that you require would be something of high resolution. You want to have one or two probes, but mainly just one linear probe because of the beam. You know, we want high resolution, superficial, so you don't need anything huge. Once again, then it goes back to your place of work. So you can have a handheld, which is still, you know, pretty good. I don't work with handhelds. I've got a nice little Vino system. Now, the reason why I have a Vino system is because for me, I think it's great for the sort of work that I'm going to be doing, you know, and the sort of work that I do. I'm very comfortable with that system, and it's very, very affordable. So that's why I like that system. It's got a nice linear probe. It's easy to use. It's not too fiddly, and the sort of like the color is really nice. The power Doppler is good. Those sort of things that you guys want to concentrate on is great. So it would be cost. It would be the type of machine would depend on what sort of work you're doing, and then the purchase of the machine would be whether or not your cohort or patients that you do would require that type of things. I think in future, though, to be honest, ultrasound will pretty much, well, could possibly be just an adjunct to your practice now, you know, because I think that the more that you do, the more efficient you become, and it just becomes so much easier. That's what happens, you know. Yeah, that's how it all works.
With myself and down Sunny as well, we use our ultrasound scanner, which is, we use Clarius. We use a Clarius device because they're readily available in the UK, and we pretty much use it for most of our work now. For you know, vascular mapping for all patients prior to filler treatments. We use them for assessment of complications should there be any issues. I see a lot of patients who come to me having problems from elsewhere with lip treatments, cheek fillers. And without the ultrasound, it would be far more difficult to be able to assess and treat a problem confidently. And for me, I use the device pretty much every day in the work I do. Most of it is assessment.
What made you do that? What made you look at ultrasound? What made you go, you know what, I'm going to have a look at this. I feel that it's going to help me. What made you come to that conclusion?
I'll tell you what made me come to that conclusion, Lisa. It was a lady over in the Netherlands called Dr. Leonie Schelke.
Uh-huh.
I'm a member of a complications group called CMAC in the UK, and
Uh-huh.
they've had a complications conference a few weeks back, and Leonie and lots of specialists from around the world were there. But about 2 years ago, I came across some of the work she was doing, and she had an online webinar talking about the use of ultrasound in facial assessment, in
Mm.
aesthetics work. And I
Mm.
was just interested in technology anyway. And I thought, how could this help me in my own work? And things just progressed from there. I got in touch with different practitioners who had some interest in ultrasound. I spoke to Leonie, and I got in touch with manufacturers, to find out about the equipment. And it just snowballed from there, basically.
Yeah.
Once I bought the device initially, I went through training soon after that, and then I carried out more training recently with Leonie as
Mm.
well. And
Mm.
I just try and improve my use of the device and to improve different applications, guided treatment, assessment. I get a lot of patients who come to me with complications having had treatment elsewhere, and some of them have got filler that's moved around, split, broken up. It's moved
Yeah.
into different
Yeah.
tissue layers, and without
Mm.
the ultrasound, I probably wouldn't have been able to help them in the way I can now. So for me, it's continuously evolving. It's a method of assessment and treatment that for me is improving all the time as I learn. My patients benefit as a result of that. So I've
Yeah.
got to thank, every week I mention her, Leonie Schelke over in the
Yeah.
Netherlands, and I'm
Yeah.
sure you've come across her a number of times in your work, Lisa.
Well, I was interested too because as a sonographer, particularly in my area of expertise, no one does facial stuff, and that was the thing that was the interest for me. I'm like, there's got to be something here, and then I started looking and I started because I'm not really into Instagram, but I'm trying. I'm trying to tag and I'm trying to hashtag and trying to do all that sort of stuff, which I find is really interesting, but very time consuming for me. But I love it. I'm learning. All my posts are dumb, but I'm trying. But it's very interesting, that their eyes are in really well and their techniques are very, very good. And the way in which they're sharing their knowledge on Instagram is phenomenal. So, and so then I look at these women and I'm like, this is pretty good. And now even more, it's research-based. So research-based sort of work in anything that you're doing gives it credibility. And prior to even that credibility, you're already thinking in advance and saying, okay, so does this actually work? Is it reliable? What sort of systems, So, I'm a researcher and it's like I said, I would love to meet her face to face actually, because I think we'd have a great time. I'd talk her ear off probably. But,
She's really
I
nice.
just think, I could imagine, everybody in this whole space is very welcoming, it's very encouraging. It's nice.
Yeah.
But education, research-based education, the way in which they do it, I mean, it's great. And when you spoke a bit before about education and teaching and what I do, I think it's very important to keep rehashing and attending clinics. You can do one-on-one. I'm going to the Gold Coast in early January to do a one-on-one sort of education for a couple of ladies. So I'll put together a program for them. But once again, it is for the cohort of clients that they will be seeing. Because there's so many things that you can do in facial aesthetics with ultrasound, and you just spoke about a lot of them, like the complications, identifying previous product. If it's in one place, it's not, like Mobin was doing that study with the with the MRI placement of filler and where it had moved. And when I was down there with him, I actually found filler on ultrasound that wasn't on the MRI. So these are little things that So ultrasound has a place, it's cost effective, it involves the patient, it gives the patient, they have more trust because they're like, oh, they know what they can see, you know?
Yeah.
And
Yeah.
not that they doubt that anyway, but you know what it's like if someone's going to have a baby ultrasound, if they see the baby, they're like, sweet, you know?
Yeah.
Or they see their shoulder moving and they know the tendon's okay, so they don't have to have a shoulder reconstruction, so therefore the pain is due to they hurt it. You know, it's
Yeah.
little things like that, and it really has a place actually with facial aesthetics. Yeah.
It's one of the viewers, Dr. Jose Ferrandis, who myself and Sunny interviewed a couple of months back. He's mentioning aesthetics. It's one of these practices where in other areas of medicine, ultrasound and visual assessment, using different radiographical methods, that's quite normal. Those techniques have all been used for all areas of the body, but aesthetics, for some odd reason, the whole idea of using that technology in aesthetics just seems odd compared to other areas of medicine. So he was just mentioning, he's been working with different techniques and assessment since 2013, and dermatological assessment using ultrasound has been going on for a number of years, and he's been involved in a lot of that. And he mentions about the whole idea of that ultrasound should be a normal part of aesthetics work, just like it is in any other area of medicine.
I know.
What do you think about that, Lisa? In your...
I agree. Yeah. No, I agree with what he's saying. I mean, the shoulder surgeon that I work with, his wife is a very well-respected dermatologist, Professor Day Morel. So we were using ultrasound to look at certain parts of skin, the dermis, the epidermis, the interstitial fat layers, looking for, skin lesions and trying to work out their margins. So but as to why it hasn't been used, maybe because it's hard. The face is an area that is, you've got to be really, you've got to be really careful. If you maim some other part of the body, you can cover it up. You know what I'm saying? And that's true. And that's why I'm in awe of all of you with your experience. It's just like me going into a room going, oh my God, I'm the sponge. I'm just sucking all this energy up, because it's phenomenal. And the face is challenging, and those people are trusting you, and patient expertise, not expertise, but practitioner expertise, trying to meet patient expectations. Well, that's a challenge in itself, right? So if you could possibly, I think of these things, and if you could possibly use ultrasound, right, you could say to someone, look, you want to have this done, but look at your skin, look at your fat, look at this layer. This is why we're thinking not to do this. This is why we think we might do that. Then someone will go, oh, okay. And you can say, now, if you clench your jaw, that's why it's sticking out so much. So if we, put, settle down the masseter, this is what it may do. So, it makes, it's, I'm just thinking of all these things, but it will be wonderful, but it's hard. It's a hard place. That's why.
It's like anything. It takes time, it takes practice, it takes education and training to try and improve as much as possible. I can't believe we've been talking for a good 30 minutes or so already, Lisa. we could talk all day. What I was thinking was, in terms of the future, you're doing a PhD in the use of ultrasound in different areas of medical practice. What do you see as the future of ultrasound scanning in aesthetics work, facial aesthetics work? How do you see things changing over time in Australia and around the world in terms of ultrasound use?
I think it's got legs. I think it's going to go great guns. I think there's a role for it. I think the education that's available right now is really pretty much second to none at the moment. I'm really impressed. And I'm very happy to be in the forefront of that. I think it really has a place. I think in the future, and this might be a little bit, jumping out there, but I would say ultrasound is going to be readily used within the next 5 years. I reckon in Australia for sure. Yeah. I really do. It's got a place because it's necessary. And these sort of podcasts and education online with Instagram shows you that it has a place. So when it has a place, then people start to listen. Then people start going, "Hang on, why aren't you using ultrasound?" It's a given, And that's what's going to happen. It's the same as what happened with the MSK in the very beginning. I was told not to take that job. Don't take that, it's not going to work. And I'm like, well, I'm going to take it because I reckon it's unreal and I can see inside, and I'm going to be able to show people if they've got a hernia and what it looks like. Yeah. And I'll learn in the meantime. And this is exactly the same way I'm feeling about this. It has a place. It really has a place. And there's a lot of you around that have got so much expertise already. It's just going to marry and fuse beautifully, and I would love to be a part of that, because I just think it's amazing. It's good.
I think you do a fantastic job, and it's really nice to be able to speak to you. And you're such a nice person, you're a really nice person to speak to. And it was really nice to be able to get chatting with you over the last couple of weeks, talking about different aspects of aesthetics and ultrasound use. And we've got to thank Morbin Master and Stuart as well for bringing us together. So I've got to thank the two of them. In terms of the future, hopefully we'll meet up at some point. Yourself, Jake, Stuart, Martina, Morbin. There's so many people that myself and Sunny would love to meet.
I'm thinking, this is what I'm thinking. Being an Australian, I am thinking that halfway through next year, we meet in the middle. So we meet, say, somewhere in the middle of the world, just pick a really nice warm place. We have a destination inaugural conference where everybody comes together and we share and we discuss and we set protocols and we get the ball rolling, so we're all on the same page and we can all stand there together and go, let's just go for gold with this, because there's so much that can be done with this, not just in, aesthetics in the sense of complications or, extending the face or things like that. It can also, I feel it can have a role in actual reforming a face to help bring a face back from those that have been unfortunate due to surgery or accidents and stuff, where you can actually measure the consistency and thickness of tissue and then map it on the other side and build it, even with fillers or even with something like that. It could be being done now, but I there's just so many areas of people that could share their knowledge, and ultrasound can show that. Yeah.
It does. As I've learned and continue to learn, it's such a valuable technology that can make a big difference to the work that is done in facial aesthetics. I've got to thank you, Lisa, for joining me this evening in Sydney and this morning in the UK. Myself and Sunny will be back next Thursday, the 15th at 8:30. Hopefully he won't be still stuck in the snow then, and he'll be joining me next week. We'll be talking about maybe just a summary of different areas of work that we've both been doing involving ultrasound, and it's going to be nice to be able to speak to you and maybe hopefully see you next year. It'd be really nice. If practitioners would like to get in touch with you, they can do that via your Instagram account, the Ultrasound Educator. Is that right? Yeah. Yes. And you'd be happy to give them information and advice about the work that you do. Yeah.
Yeah, for sure. Yeah, I'd be flattered, of course. Yeah. Right.
Great.
That's how we learn. Yeah.
Anyone who's watching,
I want to say to you, thank you very, 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 very much. I've totally enjoyed this conversation today, and I will meet you. Maybe we should sort of get together and organise something for next year, because I just think it's going to be amazing. I'm actually really flattered and honoured that you even thought to. I'm happy.
It's a total pleasure for me to be able to speak to somebody as nice and as knowledgeable as you about the whole idea of ultrasound use and aesthetics. Lots of fantastic people around the world, and it'd be nice to be able to see you, speak to you, and do the same with a load of other specialists from around the world as well. So thank you very much for joining me, Lisa. It's my pleasure. My pleasure. We'll continue with. Oh, it's as I say, you're such a nice person to be able to speak to, so it was a real pleasure for me.
There it is. There it is. Merry Christmas.
Oh, very nice Christmas tree over in Sydney.
Yes.
But as I say, we'll be back we'll be back next week. We'll continue with our lives, myself and Sunny. We'll have all of our Instagram lives as a podcast as well, so practitioners can listen. And I'll pop a post, a story with a link to this live for anyone who wants to watch it after we finish. So again, thank you very much for joining me, Lisa. I hope you have a fantastic Christmas in a couple of weeks' time, and we will try and hopefully meet up at some point next year, and maybe with other specialists from around the world too.
Yeah, we should get on to that, I think. All right, lovely to meet you.
You too.
Say happy Christmas to Sunny, and I hope he's out of that snow.
Yeah, I hope so. I hope so. Nice seeing you, and have a great time, Lisa.
Okay,
see ya.
Bye. Bye.
Bye.